As we age, our bodies begin to communicate in subtle ways. Some messages are loud and clear: a sudden ache, a sharp pain, or a dizzy spell. But others are quieter, hiding in plain sight. One of the most overlooked indicators of our internal health lies not in what we feel, but in what we see. More specifically, in our nails. For seniors, nail health is more than a cosmetic concern. It's a mirror reflecting what might be happening deep inside the body. Changes in color, shape, and texture can act as silent alarms, warning us of issues ranging from circulation problems to respiratory conditions, nutritional deficiencies to hidden infections. Imagine this: you're trimming your nails one day and notice a strange yellow tint, or a ridge you've never seen before. You shrug it off. But what if that small change was your body's way of whispering, something's not right? In today's story, we'll explore 4 specific changes in nail color and texture that seniors should never ignore. These are not random shifts, they are signs backed by research and real-life medical insights that can help you detect potential health problems early. Because when it comes to aging well, awareness is half the battle. And remember, the goal here is not to scare, but to empower. To equip you, or your loved ones, with the knowledge to recognize what matters, and to act on it with wisdom and care. Let's begin. 1. Yellowing nails, the hidden signs of systemic trouble. At first glance, yellow nails might not seem like a big deal. After all, as we age, our bodies change, and discoloration here or there feels like just another part of growing older. But when your nails begin to turn yellow, thicken, or grow more slowly, your body may be trying to tell you something much deeper is going on. Yellow nail syndrome is a real condition, recognized by dermatologists and geriatricians alike. It's characterized by nails that are tinted yellow, may appear slightly curved, and often grow slower than usual. But what's alarming isn't just the color, it's what may be causing it. For seniors, yellow nails can be linked to chronic respiratory illnesses. Studies have shown that people with conditions such as chronic bronchitis, sinus infections, or even undiagnosed lung disease sometimes develop this yellow hue in their nails. The connection? Poor oxygen circulation and a stressed lymphatic system, both of which impact nail growth and coloration. But there's more. Yellow nails have also been tied to diabetes, a condition that silently affects millions over 60. When blood sugar levels remain high over time, it impacts blood vessels and circulation. This can cause nails to become discolored, dry, and brittle. One of Dr. Lynn's elderly patients, Margaret, came in complaining not of lung issues or pain, but simply that her nails looked dull and yellow. Upon further examination and blood work, it turned out she had undiagnosed type 2 diabetes. That yellow tint on her nails was one of the earliest signs. Fungal infections are another culprit, especially for older adults who may have reduced immune defenses or poor circulation in the extremities. In such cases, nails may turn yellow, become thickened, and even start to lift from the nail bed. If not treated early, these infections can spread or worsen, making daily life uncomfortable and even painful. So what should you do if your nails start to yellow? First, observe closely. Are your nails also thick, brittle, or separating from the skin underneath? Are you experiencing respiratory issues or frequent colds? Do you notice excessive thirst or fatigue, common symptoms of diabetes? Second, don't dismiss these signs. Bring them up with your healthcare provider. A simple nail change could lead to a deeper understanding of your body's needs. And third, care for your nails gently. Avoid harsh nail polishes or acetone-based removers that can worsen discoloration. Practice good hygiene. Keep nails trimmed, dry, and clean. And most importantly, stay curious. The more you pay attention, the more empowered you become in your health journey. Because your body is always talking to you. And sometimes, the message is painted right on your fingertips. 2. White spots and lines, clues hidden in plain sight. For many older adults, noticing a small white spot or streak on a fingernail might trigger a shrug and nothing more. Probably bumped it, they say. It'll go away. And often, they're right. Minor trauma to the nail bed can indeed cause temporary marks that vanish over time. But when white spots or lines become frequent or permanent, they could point to something far more important, the internal condition of your body. Let's start with the most overlooked sign, leukonychia, the medical term for white discoloration on the nails. While temporary white specks are usually harmless, persistent white lines running horizontally across the nail, known as Mies lines, can signal serious systemic issues, especially in seniors. Mies lines were first described in patients suffering from arsenic poisoning, but modern research has revealed they can also appear in individuals with kidney failure, heart disease, or even severe malnutrition. These lines develop when there's an interruption in nail growth, often due to physiological stress or toxic exposure, and the result is a telltale marker of internal dysfunction. Dr. Lin often refers to nails as the mirrors of your bloodstream. Why? Because nails grow slowly and steadily, and any long-term issue in the body, like protein deficiency or zinc depletion, can subtly interrupt this growth. In elderly individuals, especially those experiencing appetite changes, medication interactions, or absorption issues in the gut, nutritional imbalances are not uncommon. Consider the story of Harold, a 78-year-old widower who maintained a generally good diet but began skipping meals after his wife passed. His energy declined, his memory became foggy, and his doctor noticed white bands forming across several nails. Blood tests revealed that he was significantly low in zinc, a mineral crucial for immune function, memory, and wound healing. With dietary adjustments and gentle supplementation, Harold's health, and his nails, gradually improved. But there's more. Terry's nails, another form of white discoloration where the nail bed appears pale or white with a thin pink band at the tip, have been linked to liver disease, congestive heart failure, and diabetes. In seniors, especially those with a long history of medication use or alcohol consumption, these signs warrant deeper investigation. And what about those tiny vertical ridges that sometimes turn white under the right light? While common with age and usually benign, they can also signal chronic dehydration or a slowdown in nutrient absorption, something particularly relevant for older adults who may be on diuretics or managing gastrointestinal conditions. So what should you do? Track the changes. Keep a visual diary of your nails once a week. Are the spots changing shape or spreading? Do new ones appear regularly? Look at the whole picture. Are you experiencing fatigue, weight loss, or swelling? White lines don't occur in isolation, they often reflect a broader pattern. Speak with your doctor. Share your nail observations, especially if paired with other symptoms. Blood work can rule out or confirm underlying deficiencies or organ issues. Finally, nourish from the inside out. Focus on foods rich in zinc, biotin, protein, and omega-3 fatty acids, like eggs, leafy greens, salmon, and lentils. Hydration is also key. Aim for consistent water intake to support nail matrix health and skin elasticity. In the end, it's not about obsessing over every mark, it's about learning to listen. White spots may seem small, but in the symphony of your health, they can play a vital note. And when you learn to read them, you take one more step toward mastering the quiet language of your aging body. 3. Yellowing and thickening nails, a silent cry for help. When we think of signs of aging, yellowed or thickened nails may not immediately come to mind. Yet for many seniors, this change becomes a quiet, persistent reminder that something isn't quite right. What seems like a simple cosmetic issue often hides deeper truths about circulation, immunity, and even respiratory health. Let's begin with the basics. A slight yellow tint to the nails might simply result from aging or repeated use of nail polish without a protective base. But when the yellowing becomes pronounced, paired with a slow-growing, brittle, or thickened texture, it can be a warning sign of more serious health concerns. One such condition is yellow nail syndrome. Though rare, yellow nail syndrome most often affects individuals over 60 and is characterized by slow-growing, curved, thickened nails with a distinct yellow hue. But it doesn't stop at the nails. This syndrome is frequently accompanied by chronic respiratory issues like persistent cough or fluid in the lungs, and lymphatic dysfunction, which leads to swelling in the legs or arms. In this way, the nails aren't just reacting to what's happening, they're reporting it. Dr. Lynn often shares the story of Ruth, an 81-year-old retired teacher who complained of swollen ankles and mild shortness of breath. Her primary care visits yielded no immediate answers, but during a routine check, her physician noticed her nails, thickened, discolored, and curved. A closer evaluation led to the diagnosis of yellow nail syndrome. With proper care, including respiratory therapy, lymphatic drainage, and nutritional support, Ruth not only improved her symptoms but also regained a sense of peace knowing she had an answer. But even outside of rare syndromes, yellow or thick nails in seniors are commonly linked to fungal infections. In fact, onychomycosis, a fungal nail condition, is one of the most prevalent nail disorders in adults over 60. Fungi thrive in warm, moist environments and often sneak in through tiny cracks in the nail or surrounding skin. Over time, the infection causes the nail to discolor, thicken, and become brittle. Left untreated, it can lead to discomfort, difficulty walking, and even bacterial infections. Yet beyond fungal causes, yellowing can sometimes point to diabetes, thyroid disorders, or poor circulation, all more common in the elderly population. That's why it's important not to dismiss nail changes as just part of getting old. So what can you do? 1. Practice daily observation. Set aside time once a week to inspect your hands and feet. Take note of any new discoloration, changes in thickness, or brittleness. 2. Prioritize hygiene. Keep nails trimmed and clean. Use tools specifically for nails, not shared with others, and disinfect them after each use. 3. Avoid overly tight shoes. For toenails in particular, pressure from shoes can aggravate thickened nails or worsen fungal conditions. 4. Talk to a podiatrist or dermatologist. If you notice yellowing, thickening, or changes in shape, don't wait. Early intervention can prevent discomfort and more serious complications. And most importantly, don't feel ashamed. Nail changes are not a reflection of neglect or vanity, they are part of the body's way of communicating. Listening to your body, even in quiet ways, is an act of self-respect and courage. In our later years, We often look for signs of life, of love, of connection. The beauty of aging gracefully is learning to notice those signs even in the smallest places. Your nails may not speak loudly, but they do speak. And when you respond with care, attention, and love, you show your body and your spirit that you're still listening, still honoring, still thriving. 4. Dark or black lines under the nails, the silent alarms you should never ignore. At first glance, a dark streak or black line beneath your nail might look like nothing more than a minor injury. Maybe you bumped your hand, closed a drawer too fast, or assumed it was a harmless bruise. But what if that tiny line is your body whispering something more urgent, something you shouldn't ignore? As we grow older, our skin and nails change. But subtle dark lines that form vertically beneath a nail, often resembling a splinter or thin stripe, can signal serious internal changes, some of which could be life-threatening. Let's start with the most urgent possibility: subungual melanoma. This is a rare but aggressive form of skin cancer that begins under the nail, most commonly in older adults. It's not caused by sun exposure like other skin cancers, which makes it even easier to overlook. Unlike a simple bruise, this mark doesn't grow out or fade. Instead, it slowly expands, often darkening over time. According to the American Academy of Dermatology, early detection dramatically improves outcomes. Yet many seniors mistake it for a blood blister and delay seeking help, sometimes until it's too late. But not all black lines mean cancer. Splinter hemorrhages, tiny blood leaks under the nail, can occur due to trauma, but in the elderly, they might also point to something deeper: infective endocarditis. This is an infection of the inner lining of the heart, more common in those with heart conditions or weakened immune systems. When bacteria enter the bloodstream, even from a dental cleaning or a minor wound, they can settle in the heart and create silent inflammation. Dark nail lines can be one of the early visual clues. Then there's the issue of nutritional deficiencies. Vitamin B12 deficiency, common among seniors, can sometimes cause pigmentation changes in the nails. Iron deficiency anemia, another culprit, might also create lines or unusual discoloration. These issues may not seem urgent, but left unaddressed, they can lead to fatigue, cognitive decline, and overall diminished quality of life. So what should you look for? A vertical dark line that doesn't grow out with the nail. A widening or darkening stripe over time. Pigmentation that spreads to the cuticle or nail fold. Multiple nails showing similar marks without any known trauma. Lines accompanied by other symptoms like fever, fatigue, or unexplained weight loss. If you see something that raises concern, do not brush it off. A quick visit to your dermatologist or primary care physician can make all the difference. Most importantly, don't fall into the trap of "it's just old age." Our bodies speak in whispers before they scream, and our nails are one of the most subtle messengers we have. Take a moment today to really look at your hands. They've served you through every season of life. Those lines, colors, and textures, they may be trying to serve you still, offering quiet warnings that could protect your future. Because after 60, caring for your nails isn't vanity, it's vigilance. Your hands have held so many things: loved ones, memories, and the quiet labor of everyday life. And yet, tucked beneath those hands, your nails may be holding something else: messages, clues, gentle warnings from your body that say, "Please, notice me." A change in color. A ridge that wasn't there before. A thin black line that won't go away. They may seem small, But after 60, there's no such thing as a small signal when it comes to your health. Your body is wiser now, more delicate in the way it speaks. And your job is to listen. This isn't about fear. It's about respect for the life you've lived and the one you still have ahead. Because aging isn't a decline, it's an evolution. And staying aware of the subtle signs, like those in your nails, is a powerful way to take ownership of that evolution. So today, let this be your quiet promise to yourself. You will pay attention. You will protect the vessel that has carried you this far. And you will keep walking forward, not just older, but wiser, stronger, and more alive than ever. Your story isn't slowing down. It's deepening. Let your care reflect that truth.